Hi, everybody, and welcome to Organizing Life's Daily Demands. My name is Peter Gordon, and I'm the president of New York Financial Organizers. We are daily money managers. We help people pay their bills, deal with all the non-investment side of finance, and generally deal with life's daily demands. And the purpose of this podcast is to interview other people who can help individuals with different specialties than what I have. And today I'm really excited to have Daniel Elliot here of Jukebox Health. Hi, Daniel. How you doing?
How's it going, Peter? Thanks so much for having me today.
Things are well on this beautiful pre-spring day.
Yeah.
Um, so, yeah, Daniel and I work in a service that very similar people. We work with a lot of seniors, and I met him a few years ago, and I just love his service. And so, tell us a little bit about Jukebox Health.
Sure. So Jukebox Health, at its core, we're a clinically led home modification company. I think there's a lot of challenges in healthcare that we're tackling, and the main one being the physical environment that our clients and patients are interacting in, and specifically the home as well. Um, we see so many older adults who want to stay home, but a lot of times they just really don't know how that can be done. And a lot of times it's becoming too late where they're saying, okay, I can no longer live in my home. The only option is facility based care or assisted living. And there's absolutely nothing wrong with that. There's always a place for those types of facilities. But what's happening is people are sort of left and forced to go into that scenario when they otherwise would want to stay at home. So yeah, our clinicians are leading the way in identifying lots of different home hazards during their assessment. And what we really want to do is empower our clients and patients to choose how and where they age as well. Um, yeah, and there's just been so many challenges with home modifications. Um, Again, that we're tackling that we're super excited about, and I think our service being turnkey can really help a lot of families, and that's what we've been doing. We've served thousands of families at this point, so it's been really great.
Yeah, I know when I first became associated with geriatric care, for lack of a better term, was when my
Hmm.
father was ill many years ago. And we finally met a care manager who came in, and she didn't have your expertise, but right away she was
Hmm.
talking about grab bars, picking up rugs
Yeah,
off the floor, doing things that
yeah.
you do to stay safe. And now I talk to a lot of people who want to age in place. I mean, that's what
Hmm.
my parents did, and it's much more preferable. But to do that, it needs to be a safe environment,
Right.
and that's why I love what you do, and we'll get more into that. But how did the name? We didn't talk about this, but how did
Oh
the
yeah.
name Jukebox come about?
I get this question all the time, so hopefully I could do a good job explaining how the name came up. So when we were coming up with the name and thinking about a jukebox, right? You think of being in a diner, years ago. And for the clients that we serve, it's something that's nostalgic. To them, we want them to think about their community and being out and about. And those are the places where jukeboxes are. Um, so that's one thing we wanted to elicit that response of nostalgia and community engagement. And then sort of on a deeper level, when you go up to a jukebox, there's a lot of different options available and you can choose what you like. And that's one of our core tenets is we want you to be able to choose the changes that you make in your home, and we want them to be according to your personal lifestyle, your aesthetic, your home's character, and everything like that. So, sort of two meanings into Jukebox Health, and we really felt that was the best representation of what we were doing on sort of a symbolic level. And kind of as a funny aside too, we had first started off. There was about five of us on the team. We kind of bootstrapped Jukebox Health, and um, we eventually raised some money from some really great venture firms that specifically focus on healthcare. So we had the opportunity to do rebranding, and when we went with our branding specialists, they didn't change the name. So they're the experts, and they said, "Hey, we love this name too." So that was sort of our test to say, "Okay, Jukebox Health is a good name." So, but
That's
get that question all the time.
I'm sure you do. Um,
Yeah,
what's your background specifically?
sure. So I'm an occupational therapist. I started off in private home care, and that actually just led to me going, fully diving into home modifications. I was treating patients in their home, which I love to do because it's contextual. You're working with people on the specific activities that they want to be doing. Um, a quick background about occupational therapy, because some people ask what's the difference between OT and PT.
Absolutely.
Occupational therapists are function-based therapists. So what that means is we work on some of the basic skills: dressing, feeding, bathing, toileting, all of those things, because those are really important for people to be able to do. And when you can't do them, you experience a very heavy loss of independence. So our goal is to get people to start doing those things again. And then even further is what we call instrumental activities of daily living, which really just means, you know, the things that you want to do, right? So your
It's
basic activities.
instrumental activities of daily living.
Yes, instrumental. So you have your activities of daily living, which is what I consider the things that you kind of have to do to get your day started, right? You have to dress, you have to bathe, you have to use the toilet. But then all of the fun stuff, going out in the community, shopping, seeing grandchildren, all of those things are what OTs call instrumental activities of daily living. And those are the things that I love working on as well. So that's what OT works on. We complement and supplement physical therapy very well, because you need to have endurance, you need to be able to walk well, you need to have balance in order to do all of your activities of daily living. So we're oftentimes working together. So I'm an occupational therapist, was working with people in their homes, and most of the time a plan of care is going to be between, anywhere from 1 to 3 months long, where you see that person 2 to 3 times a week, and you're really working with them one-on-one on what we call the intrinsic factors. So you're working on those skills with them, but the environment is actually pretty challenging to address, because there's just not enough supports in place for the clinician. If I'm seeing 7 to 8 people a day doing documentation, it's really hard to go home, find the right products to do home modifications, find a contractor who's trustworthy, facilitate that happening as well. So what ends up happening is you work with that person, you help them reach their goals, and then, a lot of times 6 to 8 weeks later, my patient will call me back and say, hey, like, I haven't been able to do this. I haven't been keeping up with my home exercise program. I need you to come back. And to me, I want the changes that I make for my patients to be lasting. And what I felt was missing was addressing the environment to help facilitate that. So I dove right into home modifications, got certified as a certified living in place professional, and actually just started doing one-on-one consultations and project management. I set up myself as the clinician and project manager, like a small network of contractors locally, and then did a bunch of projects, mostly bathroom remodels or like grab bar placement and other things like that. And then merged with Jukebox Health, where those original founders have so much experience with growing and scaling healthcare technology companies. And they were building literally a technology and platform to help clinicians easily implement home modifications. And I just thought it was amazing. And I said, hey, like, I can be the sort of subject matter expert on what families want from that perspective. I would love to combine this technology and really help scale it and empower other clinicians to be able to do this. So that's sort of where I started, and then where I'm at now. At Jukebox Health, I lead clinical partnerships. So I have this really unique role in getting to speak with all different home services providers, healthcare systems, even insurance companies that are considering covering home
Oh,
modifications. I
excellent.
get to talk to them. Yeah. I get to talk to them about how they can implement home modifications into their care plan or into their transition of care plan, because it's really something that not a lot of health systems are doing for patients right
So,
now.
like, what insurance companies would be responsible for that or take the initiative to do that? What type of insurance?
Yeah. So um, Medicare traditionally has not covered home modifications. So things like grab bars, lighting, ramps, stair lifts, things that are really important, but they're just not
Right.
covering.
That
They
make a
do,
big
they,
difference. That pay for
right,
themselves.
right. They do cover durable medical equipment, which is
Oh,
really simple stuff: walkers, wheelchairs, commodes, canes, um, those types of things, but those are less permanent, and those are really for like the first couple of weeks where maybe you return home from the hospital or something like that. But nobody wants a bedside commode, you know,
No,
for
nobody.
months, right? Yeah. So, but in terms of the insurances that are beginning to cover them, there's this huge wave of older adults enrolling in Medicare Advantage plans. Because if you think about it, if you or I or our employer has Aetna, right, and we have the same Aetna doctors our whole lives, when we turn 65 and we find out that doctor is not enrolled in Medicare, we don't want to leave that doctor. So we decide, hey, I'm going to go with Medicare, Aetna's Medicare Advantage plan. And those Medicare Advantage plans have a little bit more latitude as to what sort of supplemental benefits they want to provide. Home modifications or home safety assessments can be one of those things. And there's a subset and cohort of Medicare Advantage plans that are already doing this, which is really amazing because they're identifying that there's a true need for things beyond durable medical equipment, things beyond the commode.
Is that in the New
Yeah.
York metropolitan area?
So there's a few of the MLTCs, so like Health First, Emblem Health, they're managed Medicaid. So state Medicaid
That's
programs.
different. Yes.
Yeah, so state Medicaid programs are
That would make
in
sense.
certain instances covering modifications. Yeah. But yeah, in New York, there's not many MA plans that are actively covering home modifications. They're certainly thinking about it. We're working with some different plans in other parts of the country, though, where it's already a benefit, which is really exciting.
Right, and in theory, people from all over the country are listening to this. So,
Yeah.
yeah, that makes sense. That makes sense. But I know a lot about Medicare Advantage plans, and there are pros and cons. And that obviously would be a pro if it works out for that individual. You mentioned scale. So why have home modifications been so difficult to implement at scale?
Yeah, I mean, if you think about we're in New York, so thinking about a health system like Mount Sinai or Northwell Health, these are huge health systems that see so many patients, and they have their core services, right? As especially as somebody transitions home, you have home health, the nurse, the OT, the PT, and other services. And then on the other side of actually implementing home modifications, you have your general contractors, right? And those two groups never speak to each other, right? There's not a system set up. Right,
Yeah.
exactly. So it's really challenging for these health systems to take on all of this communication that would be possible with various general contractors throughout their coverage area, right? In addition to that, the healthcare system is already complicated as is. Now you layer in the U.S. housing system. That's another complicated sector, right?
Yeah.
So combining those is a really tough challenge. So I would say that's the biggest thing is the patients who need these home modifications most, the health systems that are serving them are just not set up to communicate with home modification or not even home modification with general contractor companies. And I think also, home modifications is a bit of a niche right now. So not all of the clinicians are aware of every single product and potential solution that's available, right?
No,
our clinicians who,
from my experience working with you, I see that.
Yeah. I mean, one example that I give quite often is, there's two. One is automatic stove shutoffs. Somebody has cognitive impairment and you're worried about them leaving the stove on and causing a fire. You can install an automatic stove shutoff that will shut off if the person leaves it unattended, which is so huge for individuals and preventing fires. And then another one that's actually really common sense is motion censored lighting. I recommend that all the time. And it's really cost effective. And it's just something that not every clinician thinks about off the top of their head. We think about grab bars and we think about raised toilet seats, but there are a lot of other things to help individuals. And it's something that we try and stay on the forefront in terms of, what are the new home modification solutions that are out there. So yeah, I would say
what really impressed me about working with you, and I know other clinicians don't think in this way, was that you focused on the caregiver as well as the individual getting the care. and what was safe for them and what would help them. And I really love that, and too much, there's not enough attention given to the
Yeah.
caregiver and also what's safe for them. Do you want to talk about that a little bit?
Yeah, absolutely. I think there's a few different layers to that. Um, One being the mental health of caregivers. You know, there's a few different scenarios, but take for example the adult child who maybe has children of their own that they have to take care of. They're still working, and they have a parent, an aging parent who might have some issues, and they need to caregive for them as well. So what we're seeing is a lot of caregiver burnout if it's a family caregiver, and a lot of clinical levels of depression in many caregivers as well because they're just so overwhelmed. And then on the more professional side with the home care agencies, there's a really interesting workforce study that found that home health aides have a 44% higher injury rate for their low back and other areas compared to the average US workforce. So what we're really trying to do is on the family side and really on the home health aide side as well is reduce that level of caregiver burnout by making the environment work for the patient or client a little bit better, right? This is kind of a more personal example, but if I have a wife, right? And eventually we're going to age and be hopefully 90, 100 years old. And if I have to use the bathroom and she has to help me, like that's not a great situation, right? Take care of all my things on the toilet. But if I install a bidet, now I can take care of myself with the push of a button. And that's going to help reduce one of those, I wouldn't say awkward, but one of those things that just you're a caregiver when you're taking care of those things for another person, right? So that's one example. And another one being, you know, something as simple as installing a new comfort height toilet instead of a 14-inch toilet, which is really low to the ground, installing a 17-inch high toilet. Well, now that caregiver who used to have to lift you off the toilet with all of their strength and potentially injure their back as many times as you're sitting down on the toilet in a day, now that that toilet's higher, you've significantly reduced the amount of lift that you have to provide. So you're preventing injury as well. So I would say those are some of the major things that we're trying to help caregivers with. And then the last one being, people caring for somebody with Alzheimer's or dementia, they're concerned about wandering, they're concerned about falls and other things like that. And we can put things in the environment in place that can help prevent that.
Right. Yeah, no,
Yeah.
it's fantastic. It's I think that's all critical. So what are Jukebox Health's plans for the rest of 2023?
Yeah, so we had some really amazing growth and actually expanded to different geographies. A lot of our growth is partnership driven. So if there's some new partners that we're working with in Florida and California, Pennsylvania.
Give me an
We're
example of
in
what a partner would be.
Sure. So, for example, working with a new health system in an area,
Right.
there's a few insurance companies that we're doing clinical programs with, one of which is in Pennsylvania and for the entire state. And then another one in Massachusetts that actually is funding their patients' home assessment as well, which is really great. So, yeah, there's a lot of really interesting, unique programs that we're doing with different partners. And then for us, once there's a really great partner that we have in a geography, our team is going there and talking to different healthcare providers and home services companies, and elder care companies, and just kind of spreading the word and saying, hey, this is what we do. I'm always actually astounded. I went down to Florida in January for example, to onboard some new partners, and I was astounded to find that there was really nobody doing what we were doing at scale. So it's really exciting, and I think it's an area that we can really help with. Yeah, in terms of the rest of 2023, I think we're hoping to continue to expand at a good pace. We don't want to outpace ourselves. We want to maintain our quality. Yeah, I think one of the big things that we're thinking about is we're working with a lot of health systems. How do we integrate with their system? Like, how does it become part of the plan of care so that automatically patients and clients are at least having the opportunity to be educated on what they can do in their home. So that's some of the big initiatives that we're focusing on is, hey, we've proven to these health systems that it's worth doing this. We've had great outcomes with them. We keep track of all that data. Now let's talk about integrating this and having more patients and clients have access to this service.
Right.
So
That's
yeah.
great. Well, Dan, thank you so much. That was,
Yeah.
really informative, and it's so critical for people to understand that these services are available, and they really, really do improve the quality of life. And as we age, and as time goes on, and people are living a lot longer, these services are going to be even more in need. So appreciate you educating everybody.
Yeah. Thank you for having me. Thanks for being an advocate. This was great.
Sure. Okay. Take care. And bye, everybody. I'll see you at the next podcast. Take care.